Hi, and welcome to the UNF MPH program. This presentation first provides an overview of the field of public health and then presents information on our Master of Public Health program. You may have heard of public health, but may not be familiar with all of the exciting things it includes. Public health promotes and protects the health of people and the communities where they live, learn, work, and play. While a doctor treats people who are sick, public health professionals try to prevent people from getting sick or injured in the first place. We encourage healthy behaviors, conduct research, track disease outbreaks, prevent injuries, educate, address disparities, and advocate for change. Here we see two links, one to the CDC and one to APHA. These are two well-known health organizations. Let's take a quick look at their websites. The Centers for Disease Control and Prevention, or CDC, recognizes the importance of public health and how it connects us all. This site explains why public health is important and how the CDC works to promote public health. At this website, you can scroll through and explore more information about what is public health, how it connects us, why it's important, how the CDC works to promote it for all of us, and even more. Next is APHA, the American Public Health Association. Here we see 10 essential public health services. This list of 10 serves as a framework for public health to protect and promote the health of all people in all communities. You can pause this video if you'd like and review them on your own. To summarize public health and what we've just learned, here is a brief 3-minute video from public health experts in the field and what public health means to them.
Public health is a vaccine that prevents disease.
Public health is a scientist who discovers the source of a salmonella outbreak.
Public health is outreach that helps prevent tobacco and drug use.
So what is public health? While a doctor treats individuals, public health looks at the health of a community. We research the risk of disease and injury in a population and take action to prevent them before they occur. Our early successes help stop the spread of infectious diseases by improving housing and sanitation. With a greater scientific understanding of health, well-being, and equity, we introduced prevention and early detection activities that helped increase life expectancy by more than 20 years.
Public health is access to prenatal services for healthy babies and moms.
Public health is safety advances like seatbelt laws that have saved millions of lives.
Public health is access to contraception and education to prevent sexually transmitted diseases.
Public health was founded on the principle of social justice. As a basic right, everyone should have the opportunity for good health. But today, improvements in life expectancy have slowed, and we do not live as long as people in many other countries. Did you know? Only a small amount of what affects our health actually happens in the doctor's office. In fact, our health is mostly determined by the social and physical environments in which we live, learn, work, and play. Forget genetic code. A zip code can mean a difference in 15 or more years in life expectancy, even if you live a few miles apart. Nearly half of Americans live in communities with unhealthy levels of air pollution, and the Flint, Michigan lead crisis taught us the dangers of our aging water systems. Poverty and poor health go hand in hand. Too many workers are denied a livable wage. They can't escape poverty and their health suffers. On-time high school graduation is a leading indicator of good health, but more than 20% of students miss this opportunity. Too many neighborhoods lack healthy, affordable food options like fresh fruits and vegetables. Addressing these complex health challenges will require cooperation across many sectors. Thankfully, public health has taken the lead in working with government, community organizations, and businesses.
We partner with city planners to design safe communities that encourage physical activity, bike paths, public transportation, and parks.
We support Medicare, Medicaid, CHIP, and the Affordable Care Act as steps to quality and affordable health care.
We advocate common sense measures to reduce gun violence. We can reduce gun deaths in the same way. We partnered with road planners and car engineers to address auto fatalities.
So what is public health? It is all of us, working together to make sure our communities are safe, prevent disease and injury, and give everyone the opportunity for good health. Join with APHA as we create the healthiest nation in one generation.
Now that we know what public health is, let's take a look at its impact. Over the years, public health has made much impact in social conditions and improving the quality of life. Examples include an increase in life expectancy, worldwide reduction in infant and child mortality, and elimination or reduction of many communicable diseases. On the next slide, we'll see a list of the 10 greatest public health achievements of the 20th century. These achievements have been largely responsible for increasing the lifespan of populations. Over 25 of the 30 years can be accredited to public health initiatives. And here they are. Number 1, vaccination. 2, motor vehicle safety. 3, safer workplaces. 4, control of infectious diseases. 5, a decline in deaths from coronary heart disease and stroke. 6, safe and healthier foods. 7, healthier mothers and babies. 8, family planning. 9, fluoridation of drinking water. And 10, recognition of tobacco use as a health hazard. Public health leaders continue to advocate for improved population-based health in an international global community. So why a career in public health? Most experts agree that the major advances in health will not come from new medical findings or cures, but from broader development and application of population-based prevention programs. Health services delivery systems are undergoing rapid change. Greater emphasis is being placed on health promotion and disease prevention to reduce costs of care by improving the health of our populations. These changes have created a broad array of new opportunities for professionals with advanced training in public health. Here's a long list of places where our public health professionals work. Public health departments, nonprofit, local, state, and national health agencies, worksite wellness programs, schools, hospitals, research settings, and international opportunities. Feel free to pause this presentation to review the long list. So now let's talk about the UNF MPH program. Our program at UNF is hybrid and can be completed in 2 years as a full-time student or 3 years as a part-time student. Our courses include face-to-face, hybrid, and DL. We are not a fully online program. Therefore, our students spend approximately 1 to 2 evenings per week on campus in evening classes. Students also complete a 150-hour internship during their last semester. We offer 2 concentrations for students to choose from: the social and behavioral science concentration and the epidemiology concentration. Our program also collaborates with many community partners to include internship site preceptors, advisory board members, and faculty research and service collaborators. We have approximately 70 students and are nationally accredited by CEF. There are many reasons to choose UNF's program. Here are a few. We have dedicated faculty. Our faculty are recognized experts in their fields, and they also are known for being personable and available to students. We offer a variety of opportunities. Opportunities exist in this growing region for student internships, volunteer activities, and permanent employment due to Jacksonville's large healthcare industry. We also offer financial assistance. We offer several graduate assistance and other opportunities through the Brooks College of Health and the Graduate School, in addition to financial aid. Our classes are small. Our students receive individual attention and enjoy small class sizes. Each fall cohort has a maximum of 30 students, allowing students to get to know each other and develop lasting relationships. We're also nationally accredited. Our program is accredited by the Council on Education for Public Health, or CEF. Our major courses focus on the CEF areas, and graduates may sit for the CPH exam or the CHES exam when they're done. We also offer something unique called an express application for those who meet the requirements. This waives the application fee, the need to request transcripts, and the letters of recommendation. Express application is only for current UNF seniors in the undergraduate public health program and recent graduates of the UNF undergraduate public health program. Specific requirements include number 1, a minimum of a 3.25 overall UNF undergraduate GPA, and 2, a BSH degree in public health from UNF, either as a recent graduate or a current senior. Both of these groups can apply through the Express application. Third, it requires that students complete the form to start during one of the 3 consecutive terms immediately after their graduation or anticipated graduation. In addition to the form, applicants must also submit a letter of intent to the program director. What to include in this letter is specified online with our program information. And finally, UNF offers an exclusive graduate tuition rate. This is offered to our seniors and recent graduates as well. This saves approximately a third of the cost of graduate tuition. UNF undergrads seeking their first master's degree are eligible. Recent graduates are eligible, again provided that they are admitted within 3 terms of graduating. And finally, why to choose UNF? We're situated in Jacksonville. UNF is located on a nature preserve in sunny Northeast Florida, approximately 8 miles from the Atlantic Ocean and 13 miles from downtown Jacksonville. The city has a population of almost 1 million, offers low-cost living, has a large public health care system, and offers numerous cultural and natural attractions. You can look at the website here to explore more about our city. UNF itself has a student body of approximately 17,000 students. We're nationally recognized by the U.S. News and World Report as a top public institution and by the Princeton Review as a best in the Southeast college. In addition to the MPH program, we also offer a graduate certificate in global health. Students may apply to this certificate separately or during their time as an MPH student. The certificate is fully online. It consists of 1 required course from the 3 listed below and 3 electives. It prepares participants with a broad understanding of global health issues, including disease transmission and management, epidemics, healthcare delivery in compromised settings, and sustainability of food and water resources. All courses must be completed at UNF. There's the website for more information, and 3 of our courses that we offer are listed there, in addition to a list of electives you can find online. We encourage a study abroad, although it is not required. For more information, please explore our website. We offer a ton of information on our curriculum, the internship, full and part-time sequences. You can review our program of study and course sequences in order so you know what you need to take each semester. You can review our program accreditation, our admissions criteria. You can get to know the faculty better by exploring their profiles. You can view what our MPH alumni are doing now. Some of them have posted where they work, so you can look at their current jobs. You can also look at other resources and jobs available in the field. You can explore scholarships and our ESG student club. Thank you for your time. If you'd like more information, please contact our program director, Dr. Alyssa Barr, at her email listed there.